Hello everyone, welcome to Talking with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, today we are going to be talking about the spine. The spine is the bone at the back, in fact not just bone, bones. It consists of 26 bones, also known as the vertebrae, that protects the spinal cord, as well as many nerves or neurons that, coming from the brain and supplying different parts of the body. You could say, if you call it wires or something like that, trying to put it in a layman's term. But the brain controls everything we do, and from the brain through the spinal cord, you have so many nerves, which is like wires that goes to every aspect of our body. So these bones, 26 of them, the vertebrae, make up the spine, running from the base of the skull through the neck, the thorax, up to the lumbar vertebra. And we have an expert who is going to be talking about the general disease conditions or disorders that could affect the spine. Of course, even just the position you sit or you lie can even affect the spine. So today, because it's something that is very crucial, especially for persons who are getting older or persons who tend to sit down a lot in the course of their job, is something that we have to be very careful about. Also, people who get involved in injuries, or accidents or things like that, falls, road traffic accidents or related injuries, how to handle those situations. And of course, the solutions, which is also available in Nigeria, in terms of managing some of these conditions. So I have a specialist, a consultant neurosurgeon, a spinal surgeon, if you like, who is in the studio already, and I know you can't wait to meet him. We'll be right back after this break, and we get to talk about spinal medical conditions, the diagnosis, prevention, and treatment. See you soon. Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, with me in the studio is Dr. Douglas Emeka Okor. You're welcome to the program, sir.
Thank you very much, Dr. Laz. And let me just state here, man, that you are doing an absolutely fantastic job when it comes to actually advocacy and health promotion and health education for Nigerians. Big up to you and also to AIT as well.
Thank you very much, sir. Thanks for that compliment. And Dr. Okor is a consultant neurosurgeon at the Federal Medical Center, Abuja, here in Nigeria's capital city. And is also well-known advocate for patients' rights. And like he usually says, Nigerian patients are worth it.
Absolutely.
Right. So let's talk about spinal health conditions. Now, I'm happy that you are very good at this in terms of sensitizing patients. So what should people watching this program know about the different medical or health conditions that could affect the spine?
Okay, so first of all, let me state, so I'm a neurosurgeon. A neurosurgeon is a brain and spine surgeon. Right. Okay, but also there are other specialists who actually look after patients who have medical conditions that affect their spine. Orthopedic surgeons. So there are some orthopedic surgeons that actually provide care for patients who actually have medical conditions that affect their spine. In your intro, fantastic intro. In fact, basically you've done most of my job for me already. Okay, the nervous system is that part of the body that actually controls everything. The brain is the master organ of the body, controls everything. Right. It generates electricity, and that electricity, for that electricity to flow to the rest of the body, like you rightly said, it has to pass through a big cable of wire called the spinal cord. Ladies and gentlemen at home, if you remember, anybody who eats fish, okay, who eats fish, right, that bone in the center of the fish is actually the spine. So the spine is actually a bone, okay? That soft thing that you actually remove from the center of the fish is actually the spinal cord. So sometimes people confuse spine and spinal cord. So spine is a bone, and spinal cord is actually that soft tissue that goes in. And the spinal cord, like I said, is the cable of wire taking electricity from the brain to the rest of the body. As the spinal cord goes down down the center of those bones that make up the spine, it starts giving off small tweaks of cable of wire that actually supply the hands, the rest of the body, the legs, the bladder, the bowel, and stuff like that. So that's how generally the nervous system is configured. So going back to the spine, again, like you rightly said, roughly about 26 to 29 bones, okay, depending, okay. The bones, they actually start from just the base of the skull there, all the way down to the lower back, okay. And like you rightly said, there are 7 of them in the neck, there are about 12 of them in the mid-back, about 5 of them in the lower back, which we always call waist. When you hear the average person saying, oh, I have waist pain. So it's usually that part they call the lumbar spine. And then there's like a tailbone. They say that from Homo habilis or whatever, that human beings used to have tails and stuff. But that last, what we call the tailbone, is the sacrum, okay. So let's talk about what kind of diseases, what kind of medical conditions will normally affect the spine, okay? A significant number of people who have spine problems will be degenerative, okay? Big words, but it just means wear and tear. Just like your windows, your doors that get worn out over time, the human body, actually, that same thing actually happens to the human body as well. Whereas you age, as you get older, you actually get wear and tear. Arthritis, arthritis. So a significant
arthritis can affect the spine.
Well, absolutely. So a significant number of patients who will come in and say, oh, they actually have problems, and you actually point to their spine. It will be degenerative wear and tear, arthritis actually affecting the spine. Second thing that affects the spine is trauma. Okay, so trauma just means anything where you have actually a blow to the spine or an impact to the spine, and usually commonplace, the most common thing that will actually cause that are road traffic accidents. But of course, you can have a fall from a height. You can have industrial injuries. Okay, someone is walking with very heavy equipment, and then that falling on the person, or the person falling from that. And of course, you can actually have sport injuries, especially contact sports as well. Okay. So like I said, first one, degenerative wear and tear, arthritis. Second one, trauma. Third thing that can affect the spine is infections. Infections can affect different segments of the spine.
Arthritis is not caused by infection?
No. So arthritis is just wear and tear, okay,
of the bones.
Aging, old age, okay, unfortunately, we'll all start getting old. Guess what, Dr. Lars? We all start getting old from the age of 25. Yeah.
I know why I asked that question. Some persons, try to make it appear that they, some persons give antibiotics for arthritis. Because they say
that's why we're doing this, to actually inform and educate. So arthritis, wear and tear, degenerative issues with the spine is all about aging, old age, wear and tear, and arthritis in the spine. It is not infection. Okay. Like I said, there is a class of conditions that will affect the spine, and they're infections. Okay. The two common infections that will affect the spine are tuberculosis and bacterial infections. Okay. You can have infections affecting the blocks that make up the spine itself, or the soft tissue in between the blocks, what we call the disc. Okay, you can actually have
so the one they call biscuit bone.
Well, so it can so every bone, in the center of every bone, you have what we call the biscuit bone. Okay, but as the bones are sitting in the center is the biscuit bone, but there's soft tissue in between the bones. Okay, and we call that they're like shock absorbers. Okay, so they're in the, so you usually you have these infections, either bacterial or tuberculosis, affecting that, but it can also spread to the bone as well. Okay, so those are the common ones. And of course, one of the things or medical conditions that can affect the spine is actually tumors, cancers and stuff. And usually it can be cancer spreading from somewhere else, a primary cancer from somewhere else, and spreading to the spine. For example, prostate cancer, breast cancer, lung cancer. They can actually spread to the spine. Okay, and usually when they spread, they are affecting the part of the spine and actually moving backwards. And remember, the spinal cord is going through it, so you now start compressing the spinal cord. Okay, and if you have an issue where that spinal cord is what's taking your electricity down, and just imagine a cable of wire and it's damaged by pressure and stuff like that, the electricity won't go to the other place, isn't it? And you can also have tumors actually affecting around the spinal cord, okay, or inside the spinal cord. Is a tumor actually arising from the spinal cord itself. So I said coming from outside, pressing on it, around the spinal cord, and actually inside the spinal cord as well. And last but not the least, you can actually have deformation of the spine. Deformities in the spine. One of the common ones is the one what they call the hunchback. Okay, we call that kyphosis. The big word is kyphosis. We can actually have bendy spine, where the spine is actually bending to one side. Okay, so kyphosis, bending backwards. Scoliosis, bending to the side. Okay, so generally, in a nutshell, these are the kind of medical conditions that will affect the spine.
Wow, so you've heard it. It could be degenerative, it could be trauma, it could be metastatic.
Just say tumors generally.
It could be infections, and also
have deformities.
So these are generally, and under each of these, there are many diseases with so many names, but it's important you understand this. We are going to take a break, and when we return, we'll go to the next segment. We'll be talking about what you do if you identify any of these health conditions. Of course, he's a neurosurgeon, and like he said, you also have orthopedic surgeons, some of them who specialize in health conditions that affect the spine. Orthopedic surgeons are in charge of bone, and neurosurgeons in charge of brain and the spinal cord. And because within the spine, you have both the bone and the spinal cord and the nerves, most times you have these two specialists being involved in health condition that has to do with the spine. We'll be right back after this break. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we'll be talking about the spine, the health conditions, the medical conditions that could affect any of the 26 to 29 bones that you could find at the back. And with me on this discussion has been Dr. Douglas Emeka Okor, a consultant neurosurgeon at the Federal Medical Center, Abuja. Dr. Okor, yes, we're going to go into the treatment of spinal conditions. So you've already run through the various categories of the condition that could go through the spine. So can we have the screen up so that there are a number of, diagrams. This must be you and your team, right?
This is us just doing some of this. I think one of the key things I need to say is that the kind of symptoms that we would look out for,
right,
okay, mainly three things: pain, deformity, and neurological symptoms. Okay? So pain is something that we really look at. Deformity, bendy, or an issue with the stability of the spine and stuff like that. Not just even the stability of the spine. Okay, if there's some sort of deformity with any part of the spine, and thirdly, neurological symptoms.
What are those symptoms?
So the neurological symptoms will range from things like numbness, weird feeling in any of the limbs or any part of the body, weakness. Okay, some having difficulty walking, some having difficulty using the hands and stuff like that. So those are some of the things that we worry about.
Weakness of the legs?
It can affect, you can have weakness of the legs. You can also have issues with control of your bladder as well. Urinating, control of using the toilet as well. Depending on the level of the injury or the damage to the spine, to the spinal cord, or the nerves coming out, and depending on where the injury is.
Does it involve swelling as well?
It can involve swelling. It depends. It can involve swelling, especially maybe in like infections, or even an infection tracks out from where the spine is out towards the back, for example. You can't see swelling. It is possible.
Okay. So thanks for talking about those symptoms. Yeah, treatments. Let's move to the next slide.
Okay, so
we have a lot of radio images from is this an X-ray or MRI?
So there are two things here on my. Okay, now right as I am on that way there, that's actually an MRI scan. And guess what, ladies and gentlemen, MRI scanners are available. Okay, they are available in Nigeria now, especially most of the big cities. Right. So that is an MRI of the cervical spine. Remember, I said there are different parts of the spine. So the cervical spine is the neck. Okay, so there are usually 7 bones in the neck. If we count from top, the one hiding there, 2, 3, 4, 5. And you can see, I talked about the disc earlier.
Okay.
Yeah.
This part.
So yeah, those are the discs. So if you look at this one here, that one is actually bulging backwards and actually putting pressure on the spinal cord. The spinal cord is that gray thing in the center there, actually going through the spine.
So this is the spinal cord.
That is the spinal cord, and you can see that white thing there.
Bones?
Yeah. So those are the bones. That's the disc. Okay. And you can see that one is bulging there, and you can see some whitening of the spinal cord in the middle there. That means there's damage to that spinal cord already. If you don't do something for that patient, remember, electricity going through the spinal cord, you can lose the function of your hands and your legs. The patient can actually become paralyzed.
Is it reversible?
So the key thing is that one of the key things, and I like that you actually asked that question, is that the brain, the spinal cord, and the nerves are permanent tissue. Once they are damaged, it's difficult to actually reverse them. That's why we have this adage that time is brain, time is spinal cord, time is nerve. So there are some actually conditions that will affect the spine that you need to actually deal with them in a timely fashion. So this patient has had an operation where you're actually coming from the front, to take out that disc that's putting pressure on the spinal cord and relieve the pressure. And because you've taken that disc out, you now put a cage there. And this is an X-ray following the operation, and you can actually see the cage there.
Okay.
Yeah. So the cage will actually fuse those 2 bones at some point in the future. Okay. So you've relieved pressure. Next slide, please.
Right.
Okay, so now this is a similar patient, but what you're just actually seeing here is same thing, a cage there, and then you can actually see we put plates and some screws to actually hold things intact. So most of the time when we do these operations, we actually fix things, because one of the things we are worried about is instability of the spine. So we
which
actually
will affect the spinal cord.
Which will cause pain and can actually pinch on the spinal cord or the nerves and actually cause more trouble. So sometimes we'll have to actually fix like that. So this is looking at the patient.
Is there a traumatic condition?
Yeah, if I remember, yeah, I think this was trauma. This was definitely a patient who had an accident and had a shift and a dislocation of the bone. So we had to actually go take that disc out, put a cage there, and actually fix it as well. You're looking at that picture from the side. So an X-ray looking from the side of the patient, and this one is an X-ray looking from the front of the patient. So you can actually see the plate there. Next slide, please. Okay, similar thing again. You can see the 2 cages there. Okay, so we've operated on 2 levels there. The 2 cages. Okay, so that's looking at from the side and from the front again.
What's this?
So that's what we call the top of. We call the hyoid bone. Okay, it's the bone at the front there. It's called the hyoid bone, which is just on the top of what we call the Adam's apple.
Adam's apple. Okay. So that's same patient from perhaps the posterior view.
Now, we've been talking about the cervical spine. Now we're going to the thoracic spine. Remember, the thoracic spine is where the cervical spine ends and is like the middle part of the spine.
Like the part
that's where
the rib cage.
Yeah, the rib cage actually touches. Okay. So this is actually a very, very interesting case. This is actually one of the big Reverend fathers around. He's also a professor. And so he had, if you look at that one, where that red arrow is there, you can almost see that there's something bulging there. Okay. Something bulging there, and this is your spinal cord, and it's pressing on the spinal cord, okay, in the thoracic spine. Remember, spinal cord is taking all the electricity down. That's pressing on the spinal cord. This gentleman is in his almost, I think, 60 or so. He was losing the function of his legs.
Wow.
He was getting to a point where he was almost couldn't walk, and then he needed an operation almost urgently.
Was it traumatic? Or
no, so this was degenerative. So this was more wear and tear.
Wow.
So the wear and tear and arthritis can actually get to this point where you're having some swelling or like the disc actually prolapsing out and coming out and putting pressure on the spinal cord. And that's what happened here. So what we did here was that we created more space. We did so there's compression. We did a decompression to remove this, and we also did a fixation to stabilize the spine. So this is looking at that part of the thoracic spine from the side, and you can see those screws going, and this is actually looking at it from front to back. So you can actually sort of appreciate the screws there, and we actually use a rod to actually stabilize the spine.
Anyone that is watching, you may need to come closer. Anyone that is watching might be wondering, do you get to take out these screws that get to put into
so these screws, at least in the last 10 years, most of these kind of implants are made of titanium. Okay, and titanium is non-ferrous metal, so it doesn't have any iron in it at all.
No reaction.
No reaction at all. So with this, you can even go ahead and still do an MRI scan. You can walk through the airport. You know, those scanners in the airport, you can walk through without any sound or anything like that. Okay. So they are really, really good material for implants. They are strong enough, they are tensile strength, they are durable, and you don't need to remove them. If the patient doesn't have any problem with that, they stay in for life. Usually I joke to patients is that, oh, you're going to become a bionic man or a bionic woman after that.
Okay, so let's move to the next slide.
Okay, so thoracic spine again. Young lady, she was involved in an accident, and then she had significant fracture and injury to the thoracic spine. In fact, she lost the function of her legs. But the key thing, and this was actually a good story because she actually got into the theater within 48 hours of actually having that injury. Remember what I said, time is spinal cord. When you have something like this where there's an injury to the spinal cord, the time of actually intervening is really, really important. So she had this almost like 2 days after, and you can see looking at it from the side, you can see all the screws there and a rod at the back to actually hold it. It's almost like carpentry work, isn't it? Yeah, and so that's looking at it from the side, and this is looking at it from front to back.
You do this with the orthopedic surgeons or neurosurgeons that just
no, the neurosurgical team. Like I said, the orthopedic surgeons, they also do this as well.
Right.
Yeah, some of them.
Yeah. Okay, so let's move to the next slide, lumbar spine.
Okay, so the lumbar spine is probably one of the commonest degenerative wear and tear. Yeah, the waist. Okay, a good number of people actually aging, will actually come to a point where there's wear and tear. The canal through which the nerves is actually going through, you're now start having swelling, of some of the joints and stuff like that, and then the canal through the nerves now narrows, and now starts squeezing the nerves. And then you have patients who walk, they have a pain in their buttock, in their thigh, they usually walk bent like this, they walk for a short distance, there's lots of pain and stuff like that. And then when you do an MRI, you usually find out that the canal where the nerves are passing through is actually quite narrow. So one of the things we do is that, like I said, it's compressed, so we do a decompression. Okay? If there's wear and tear in the disc, remember that area in between the bones, we can put cages. So for example, you can see cages there. Okay, we put cages. Those cages help to fuse the bone, and those cages, that fusion. Yes, same thing. So you're looking at that from the front, and you're looking at this from the side. The same thing. You're looking at it from the side. You can see the screws as well. So there's a tendency for us to actually decompress, remove pressure from the nerves. We can put a cage sometimes in between the blocks of bones to actually fuse the bones. That reduces pain in the back from the wear and tear in that area between the two bones, almost like 65%. And then, because there's a tendency that by the time we've taken bone out and decompressed, that we can actually destabilize the spine, we now have to put in all these implants to fix and stabilize the spine. I think there's one more.
Yes, let's go still within
so
the
similar again,
waist, right?
Similar thing in the lower back, where we're putting implants and stuff. One of the key things, especially in Nigeria, because in Nigeria most of the care that we'll get is out-of-pocket payment. Okay, there's a tendency for us to put implants more in Nigeria. I'm trained in the UK. In the UK, if you operate on the patient without putting implants, if they come back and they have an issue and you need to put implants, they don't pay for care. So there's a tendency for us in Nigeria to say, do you know what? Let's just go ahead but not for all patients, but definitely more than in places like UK.
Right. Okay, so that's so as to prevent any possibility of having to come back
instability,
and paying out of pocket.
And exactly.
Anyway, the National Health Insurance Authority Act was signed by the president a couple of months ago. So let's hope in the near future, all Nigerians will have health insurance.
I promise you, Dr. Laz, these kind of things are very expensive. I do not think, at least in the short term and in the medium term, that the national insurance will be able to cover for stuff like this. But we hope that in the long term, so when we have governments that are in place that know what they are doing, that slowly we can build towards that.
Okay, we keep being optimistic.
Absolutely.
Can we have next?
I think this is the last.
Okay, so this is probably the last.
So we've covered neck, the cervical spine, the thoracic spine, and the lumbar spine.
So let's talk a bit about waist pain. Of course, a lot of persons get to complain about it. The posture of sitting and all of that. I know the orthopedic surgeons may have more to say about this, but what should our viewers get to know about waist pain? Some persons, you lie in a certain position, or perhaps the nature of the bed, could even begin to make the person, having some kind of pressure and postural issues. So,
when you're talking about healthy lifestyle with regards to the spine, in terms of trying to prevent, any sort of spinal issues, especially the wear and tear in the spine. So there are a couple of things. Number one, you're absolutely right. In terms of posture, the way you walk, the way you sit, sitting for long periods can kill you. Sitting for long periods can kill you. Even if you're in a big conference where you need to sit for 3-4 hours, you can get up after 45 hours, 1 hour, stroll around, come back again. That's really, really important. Of course, your sitting posture, sitting like that, do you understand? Or sitting like that and stuff like that, you're putting too much stress on the spine.
So it's better to sit erect.
It's better to sit, do you understand? Almost like that. If some people will even advocate putting some very nice things at your back to actually support your back and everything. There's what they call ergonomics at work, which is extremely important. As actually looking at the workspace and how somebody's desk is, how the person's laptop or desktop or whatever, and how the sitting position is and stuff like that. There are people who are actually ergonomic experts, but in Nigeria, most of the physiotherapists actually do that. They can go into a workplace and actually assess that. Of course, there's what they call bending, lift. I call it the BLT, bending, lifting, and twisting. They are bad for you, especially when you actually get into a particular age. By the time you get to 40, bending, lifting, and twisting, and combining them can be really bad for you, especially when you bend, lift something very heavy, and twist. You remember people who play golf and stuff like that, they are more likely to actually have disc prolapses and some spine problems as well. Okay, exercises, especially exercises that strengthen your back muscles. Okay, swimming is very, very good. A good physiotherapist will be able to give you an idea of the kind of exercise you do to strengthen your back muscles. Strengthening your back muscles keeps your spine in check and helps to actually reduce the progression of wear and tear. All of us will have wear and tear in our spine, unfortunately. Like I said, from age of 25, we all start.
And everyone prays to get old.
Exactly. So we pray that we age with grace, and then we do some of all these things that can prevent significant wear and tear or reduce the speed of the wear and tear.
Okay, that's very good. So just before we end, let's talk a bit more around TB spine. I recall I referred a patient to you.
Yes.
And I think it's a good story to tell. This young man is early 30s, a master's student, who's been having back pain and was misdiagnosed. Thanks that I shared that story with you, and was already being prepared for a major spinal surgery. Was looking for monies, and when he got to me, I said, okay, let's have a second opinion. And you got to realize that it's TB spine. So for many who don't know, tuberculosis, yes, cough of 2 weeks or more, you have to suspect it. And you do a test, which is largely free of charge in any government hospital, to confirm if it's TB. But sometimes it may not just present with cough. It may just present with back pain, and it could just be TB. So what are some tips?
I think the key thing, like I said, when we're talking about some of the conditions that can affect, we're talking about infections. And I said two major ones, the bacterial infection and TB spine. TB spine is generally prevalent in our part of the world, compared to probably maybe the developed economies.
Right.
Okay, and there are things that can actually predispose to it, reduce the immunity, things like HIV, people who have diabetes, not well-controlled diabetes and stuff like that. And usually, in terms of the presentation of the symptoms, it usually be pain. Yeah. Okay, the TB, the infection usually affects the disc. Remember that soft area? It usually affects this, but can also spread to involve the bone and spread to involve the soft tissue around it as well. And when it's affecting those things, the major problem is that, remember, the spinal cord is just in there. So it can encroach and start putting pressure on the spinal cord. So anytime you actually see a patient with pain, high index of suspicion of some sort of infection and stuff, you definitely need to check it out for TB. Okay.
So if the TB is treated, is that going to heal?
It just depends. Okay, if the TB has affected the spine and all these areas I talked about, and is now putting pressure on the spinal cord,
right.
Okay, there's a good chance that you might need to actually do surgery. Okay, and it depends on
the TB treatment.
The TB treatment is extremely important. Okay, those anti-TB drugs are extremely important. You must do that. Okay, once you've confirmed that it is TB. But now and again, you will also need an operation to relieve pressure of the spinal cord. And remember, the TB is actually damaging important parts of the spine, the bone, isn't it? Right. And it can cause instability. So you might end up doing some of the things that we watched just that way. You're actually putting screws and stuff like to actually stabilize the spine as well.
All right, thank you very much. I've been talking with Dr. Douglas Emeka Oko, is a neurosurgeon from the Federal Medical Center, Abuja, here in Nigeria. And we've been talking about spinal health conditions, treatments, and all of that. I really want to thank you for making our time to share this knowledge with our viewers.
Thank you for having me, Dr. Laz.
Thank you for watching. My name is Dr. Laz. See you same station, same time next week. Take care of your spine. You'll be happier for it. Bye for now.